A mother whose son was involved in a car crash on the weekend. He's on life support in the Alfred Hospital. And she's not allowed to see him. She hasn't been given any special exemption. What are the rules for that, and why? It would seem to me that that would be the very situation that somebody should be given special consideration. Why can't she go and see the son?
Laurel, I'm not familiar with this particular case. I'm very happy to look into it further if you provide that the details to our media team. Look, I have to say that the hospital visitor rules are very challenging for Victorian patients and their families. They have been developed in close consultation with health services and with peak bodies, in particular health sector unions and peak bodies, who had a lot of concerns earlier in the year about the risks to staff, to healthcare workers, of large numbers of visitors coming through our hospitals. So there has been guidance provided through the Chief Health Officer's directions, unfortunately having to limit the number of people who can visit both hospitals and aged care facilities, but the hospitals have the ability to, I guess, go beyond that and impose even stricter rules if they think that's appropriate to their particular circumstances. There are exemptions there for palliative care situations. I think there is a need to have some flexibility on a case-by-case basis here, where we've got such a tragic case. My thoughts are with that family. I can't imagine the heartbreak that they're going through at the moment. And if there's anything that I can do to assist that family, I'm very happy to look into this case.
Minister, there are significant medical risks that come with having COVID either before or directly after a surgery. Is the plan to offer a COVID test to every single person who goes through elective surgery?
Obviously, in emergency situations, urgent situations, that isn't always possible. People, come in and needed to be operated on immediately. That's not going to be a consideration. But what has been happening is there has been pre-operative screening for what might be called, scheduled elective surgery, where you've had the ability to get the phone call and be told you're due to come in for your surgery next week. There's the ability there for someone to get tested and to get that result ahead of time. And that's designed to protect the patient as much as the healthcare workers, because you're right, if someone has COVID at the time of their surgery, then there are more risks of complications and a more difficult path to recovery. So this is why, of course, in those circumstances, if the surgery is able to wait, then the person would be required to recover from coronavirus before accessing their surgery.
But will everybody be tested as a matter of course? As
much as is possible. As I said, with the caveat that, sometimes there is a need for urgency and that's not possible. But that's been happening across both our public and our private hospitals now, and it's intended that continue.